Good afternoon to you all. Welcome back to this last afternoon of the Regional Committee Week. A warm welcome to this technical briefing on the role of WHO Europe's geographically dispersed offices and technical centres in partnering with non-state actors to respond to the COVID-19 pandemic and the need to strengthen partnerships moving forward. We have a very exciting 90 minutes ahead for you. Very grateful that you could join us. This briefing is an important one to have later into our programme of the week, as it pulls together many of the key themes we've seen over the course of the week, including realigning partnerships to support the European Programme of Work. The Regional Director spoke to this right at the beginning of the week. We also spoke to this in the Fit for Purpose session on Wednesday afternoon, this alignment with EPW to deliver together. Before I introduce our opening speaker, the Regional Director, here to my right in the auditorium, I would like to review our two options for engagement and just remind you, the viewers and the participants, how you can engage with us today. Participants present in the Zoom room can write their questions and comments in the chat and raise their hand during the scheduled open discussion times. And as you'll recall from the programme, we have two of those discussion slots in this next period, in this next session. And of course, we will then ask you to take the floor. For participants viewing via the live stream, you can engage on Twitter by using the hashtag RC71 CPH, and we would encourage you to use that as you please. I will now give the floor to our first speaker, Dr. Hans Kluger, our Regional Director for Europe, to open the session.
Thank you very much, Rob, and good afternoon, good evening, dear colleagues. Welcome very much to the technical briefing where we will explore how WHO Europe's geographically dispersed offices, technical centres, and our colleagues and friends of the European Observatory have repurposed, innovated, and partnered to address the needs of the member states during the ongoing pandemic and looking forward how to implement the EPW, European Programme of Work. Importantly, these centres and partnerships widen the outreach of the WHO Regional Office for Europe and facilitate the inclusion of many more expert partners from around the region to ensure no voice is left behind. We had similar sessions at the previous regional committees, which focused a bit more on where and what the centres were doing. This session in particularly is focused on the how and the with. And this is because without the work of these centres and the active partnerships they foster, we will never achieve the ambitious goals of the EPW. In fact, I'm tremendously proud of the centres one by one and especially together. To illustrate this emphasis on collaboration, I have been repeating since Monday, since my TED Talk, that I really believe in the power of positive partnership. I can think of no better facilitator for the sessions than my respected colleague and good friend, Ms. Caroline Kostongs, the director of EuroHealthNet, a not-for-profit partnership of public bodies working from local to regional, national and international levels across Europe. WHO Europe and EuroHealthNet have a long history of successful collaboration and earlier this year solidified this importance and commitment with the signing of a new Memorandum of Understanding. This MOU specifically highlighted EuroHealthNet's offer to work more closely with each of the GDO's technical centres and hosted partnerships across the region in order to further maximize this added value. Therefore, a particular focus of the session will be examining how these intersectoral partnerships have addressed the pandemic and the resultant circumstances, demonstrating the important role of our non-state actors, partners, and civil society. Dear Caroline, over to you now.
I'll have to unmute myself. Yes, many thanks, Dr. Kluge, for your very kind words. And I'm honored indeed to be the moderator of this session this afternoon. And I also see this as a concrete activity as part of our freshly signed Memorandum of Understanding. Indeed, it is a Memorandum of Understanding that reflects the long-standing cooperation between the growing EuroHealthNet partnership and WHO Europe, and particularly on the public health activities that you yourself have initiated. EuroHealthNet indeed has a very broad mission of improving health equity and well-being, and we are very happy to bring our intelligence and also our intelligence of the European Union policies and instruments and funding instruments to the member states, but also to WHO Europe and the various offices for country support. Generally, I think that non-state actors have a lot to contribute to the work of WHO. I think many are still hidden treasures with a lot of information and support that they can give, which are not yet fully exploited. The non-state actors are also not one homogeneous group. There is a lot of diversity in the group. And it would be useful, I think, to analyze the NSAs and what they can offer and then to strategize, because we all want eventually a better health of everyone in Europe. So there is a lot of potential for cooperation here. And this brings me to the purpose of this session, where we'll hear from the various geographically dispersed offices, the GDOs, the technical centers and the hosted partnerships within the WHO European region, how they indeed repurposed, how they innovated, and in particular how they worked with other stakeholders in their countries to address the ongoing pandemic. We will also welcome one NSA, and nobody left outside, as one of the speakers today. In the second part of the session, we will then hear more about the various centers, about some of the lessons learned, and also their reflections on the future and how they can work with other actors to implement the EPW. And at the final part of the session, I think we'll have most time for discussions where I would like to hear from comments and also questions, but also comments from the NSAs that are in our audience. And in the meanwhile, I would like everyone to already put your comments or questions in the chat while we are listening to the various presentations. So I would now like to introduce our first speaker, Ms. Melita Jakob. She's head of office of the WHO European Center for Primary Healthcare, located in Almaty, Kazakhstan. Mrs. Jakob, you have the floor.
Thank you very much, and thank you for this opportunity to share some flavors of our work with you. It will be really bite-sized, like tapas, but I think that's appropriate for a Friday evening, which is where we are. And I do this with great pleasure, riding on the wave of commitment and enthusiasm we have seen from all of you on our Tuesday session of primary healthcare, where a new resolution has been passed, giving us and you a great mandate to strengthen primary healthcare in the future. I would like to share with you 3 examples of our work over the past year, where we did things differently than before, where we had to act differently. That both was a response to the pandemic, but also preparing us for the future. First, we developed and unpacked the notion of a dual-track health system response. And then we further developed and unpacked this meaning for primary healthcare. We developed a policy guidance and operationalized it and supported about a dozen countries to put this in place. And this was in response to the early part of the pandemic, when there was very high focus on COVID pandemic, and we have begun to understand severe disruptions in essential health services. So I believe that collectively we really managed to change the dialogue and refocus policy attention and policies on this dual track. The second tapas I would like to serve to you tonight is, as the pandemic ebbed and flowed, we understood that our comparative advantage as WHO is also to think about the medium and long term. We understood from the field and from our country visits that there is tremendous transformation taking place at primary healthcare level, that in particular, long-standing policies and reforms are being accelerated. And we set out as a goal to document and capture this rich experience that's happening at the country level and that's happening at the practice level. We launched a series of country vignettes. We work closely with 16 member states, with diverse stakeholders in these 16 member states to capture these transformative and innovative experiences from practice. These country vignettes became the foundation of the working document that went into the Tuesday session and the foundation of the resolution. We were deliberate about our choice to listen to countries. As our regional director highlighted in several sessions and earlier on the session of human resources today, we have to do much more listening and build that into our policies and policy guidance. So we already we began to practice this in addition to traditional efforts of more systematic cross-country analysis. Number three, the third tapas I will serve is that we have created cross-country platforms of exchange because we understood that policies are changing so fast that the best way for countries to learn or to understand what to do is to talk to each other. We have launched a series of talk shows, Let's Talk Primary Healthcare. We delivered 6 talk shows between December and June last year, attracting over 40 countries from the region and beyond with 1,200 participants. And we reviewed 11 in-depth country experiences on diverse topics, which included how to put in place a dual-track response, how to identify and reach the vulnerable during the pandemic, and how to strengthen the role of primary healthcare addressing post-COVID syndromes. To close, the new resolution is giving us renewed enthusiasm and momentum, and we would like to continue to work in this manner, to listen to practice and to listen to countries. We will work in an integrated manner, as our country vignettes and talk shows show, even though we are located at the eastern part of our region, hosted generously in Kazakhstan, in Almaty. We work very, very closely with all the units of the Division of Country Policies and Systems, with other divisions, and with the special program in headquarters. We have begun to build our relationship with NSAs around our new work program, in particular with WONCA, with the European Forum for Primary Care, and with others. And we will be intensifying this work in the time coming forward. Thank you for your attention.
Thank you a lot, Ms. Jakob. I'm impressed by indeed the talk shows, Let's Talk Primary Healthcare, that you have set up and managed to engage so many people. I think in particular primary healthcare at the community level allows for a lot of stakeholder cooperation, and we also think of beyond the healthcare setting with public health and prevention and even social prescribing. I think there's a lot of innovation there with other partners. That is really very interesting. I would now like to move on to our second speaker, Ms. Susie Lesov. She's coordinator at the European Observatory on Health Systems and Policies, which is a partnership hosted by WHO in Brussels. And please, you have the floor, Susie.
Thank you, Caroline. And thanks, Melita. I think we have some very similar sense of listening and integrating be important. Just to sort of explain a tiny bit, the Observatory is a hosted partnership and we bridge the evidence policy gap. So we pull together research from different silos, we combine it and we present it so that policymakers can understand what it means in practice and use it. So working across boundaries is critical to what we do all the time, and that listening and that integrating. We're very lucky in that we have 5 non-state actors and the European Commission as partners on our board alongside our 10 member states. And they really help us understand the evidence needs and the opportunities so that the work we do is shaped to be useful. But we also work with a really exceptional network of non-state actors on just about everything we do. And these NSA are the academic institutions and the academics who support our country monitoring, our analysis and knowledge brokering. There are literally dozens of institutions and about 600 individuals who we work with every year. And they massively extend our understanding and our reach. They give us access to evidence and they leverage expertise we could never hope to pay for. And we hope that, the exchanges we organize, we amplify their research so it resonates with decision makers in countries and the people who are advising decision makers, not least our colleagues in the regional office and DG Santé. So our NSA was central to the way we responded to the repurposing and to the pandemic. When it struck, countries needed a way of getting quick, clear overviews of what everyone was doing, something Melita also talked about, and the regional office and the Commission asked us to help. In normal times, we have a platform called the Health Systems and Policies Monitor, which is mostly EU focused, and each country has a detailed description, a HIT, and a team embedded in an academic institution in that country updates it online in real time. So the network, NSAs, is National Institutions of Public Health, Institutes of Health Services Research or Policy, Economics in 30 plus countries. But for the pandemic, we completely repurposed. We turned HSPM and the network into HSRM, which was the COVID-19 Health Systems Response Monitor. And what it does is capture what's happening to prevent transmission, to keep hospitals and health centers open and to keep health staff working safely, to continue to provide health services, whether those are COVID or non-COVID, and to keep paying for those services. The WHO country offices were extraordinary and stepped up to help cover the whole region, and we hope we'll continue working with them. But we didn't just repurpose, provide a baseline of information. We updated it, and then we kept evolving the product and the ways we worked as the pandemic developed. So we created snapshots that use cross-cutting analysis around very specific themes to help users to find out, for example, test and trace across the region, who was doing what, or how were countries managing to boost workforce capacity, with medical students, retirees, volunteers, what was the mix of strategies in schools, and how do you go about paying hospital and healthcare workers when all the parameters of their work have changed so radically? And we continue to react and refine what we're doing with our NSAs right the way through the pandemic, and we're still doing it. We've developed all sorts of other new products that pull out the evidence. So the webinars, which Matthias Bismarck run, was a Eurohealth last year on the lessons of the first wave, which is this one. A policy brief on how digital tools can help this year, another on long COVID, which I think is going to be a big issue, a second Eurohealth for this regional committee with Nedra and colleagues, Dorrit and colleagues for the regional committee on governance dimensions, and a study that's coming out on the practical lessons of pandemic and what they mean for building health systems resilience. We couldn't do any of these things without the NSA, and we couldn't do them without partnership. And here I wanted to say a word about our partners inside WHO. The country offices I've already mentioned, but we also work really closely with Euro colleagues. So the Barcelona office for health systems financing, they're key to keeping our analysis right and to helping member states to act on the evidence that we generate. And the same is true for the Centre for Primary Healthcare in Almaty and for the Division of Country Health Policies and Systems generally. They cover areas we can't, and they work with us on areas where there are synergies. They use what we do to help countries. So I just wanted to conclude by saying partnerships are incredibly valuable, and our partners, so WHO as host and Commission and DG Santé in particular, but our 15 member states and NSA partners, they really work to make sure our work is relevant and that we constantly repurpose as their needs change and the region's need change, pandemic or no pandemic. So they are observatory, but they're also a huge asset to us, WHO, and we hope will be part of shaping how we contribute to the evidence for building back better. Thank you.
Thanks, Ms. Leshoff. Indeed, the partnership is at the heart of the observatory's organization, and it's very structured. So that's good to hear. And I think all of us know of the great COVID response monitor that you've produced, and you very valuable instrument. I was just thinking when I was listening to you, when you talked about research and research partners, I think citizen science would be a very nice venue to look into in order to also capture the voices of the citizens in the research. And that is a way maybe to hear some of the new voices. Let's now move to our third speaker, which is Dr. João Breda. He's Senior Advisor of the brand new WHO Office on Quality of Care and Patient Safety in Athens in Greece. Dr. Breda, the floor is all yours.
Thank you very much, Madam Chair, honorable delegates, dear Regional Director, colleagues. It is an honor to address you all today at this event in the context of the WHO Regional Committee for Europe. I will speak a bit about the new Athens Quality of Care Office. In fact, data shows each year more than 8 million lives are lost globally because of poor healthcare quality. They are a reminder that every human being should have access to high quality, safe health services, covering a continuum from health promotion to palliative care without experiencing financial hardship. In fact, less than optimal quality of care is linked with significant losses and is harmful to well-being and the population, while undermining trust. As such, improvement in healthcare delivery requires a deliberate focus on quality, which involves providing effective, safe, people-centered, and primary healthcare-oriented services that are timely, equitable, integrated, and efficient. The new outposted Office on Quality of Care and Patient Safety will contribute to EPW in supporting the efforts of member states to build robust, resilient, and evidence-informed systems that are at the core of the post-COVID-19 recovery. We are grateful to the Ministry of Health of Greece and the government of the Hellenic Republic for the incredible support of the establishment of this new office as a center of excellence for quality of care and patient safety in Athens. This office will be pivotal to support our division and the EPW priorities, and is already bringing considerable added value for the region and for its member states, particularly those around the Mediterranean basin. In our region, still at times, values, vision, and strategies for quality improvement could be more comprehensive and more consistently based on evidence and stakeholder engagement. In other words, there is room for improvement. Quality is a complex, multifaceted concept that requires its design and simultaneous deployment of different interventions. The WHO office in Athens will contribute to the implementation of the EPW by acting as a center of excellence in 4 major areas. First, country support, national strategies, and frameworks, sharing lessons learned to scale up successful interventions. Country support, as RD very well put in his talk early in the week. Second, quality of care innovation and knowledge synthesis. This area needs a lot of innovation, notably by establishing a system of diffusion and deployment of those innovations. It's not enough to innovate, it's then important to incorporate and to implement. Third, policy analysis in the sphere of quality of care and patient safety. This stream of work aims to translate findings into practical know-how, deciphering priority lists of actions, policy options, mechanisms, and tools. And last but not the least, network building, alliances, and particularly stakeholder engagement. Probably these are the most significant pillar and the stream of work to be stimulated. Under this pillar, partnerships with relevant stakeholders will be developed and scaled up. In this area, the office will work to identify synergies with global health initiatives, foster partnerships with leading academic institutions, NGOs, professional organizations, and think tanks, also working across the different parts of WHO. For example, as I speak, I am in Moscow now, and our office is in Greece, and we are already working together with the NCD office in Moscow. So it's very important to stimulate those partnerships within WHO. So it's really a must. Thank you very much. And with this, I yield back to Madam Chair. Thank you.
Thanks, Ms. Breda. Indeed, quality assurance across the care pathway is super important, and indeed also an opportunity to work with others and to get input from different non-state actors about how they experience the care. I'm also happy that you mentioned the whole spectrum from health promotion to palliative care, because the palliative care also required a lot of attention during the COVID period, unfortunately. Right now, our next 2 set of speakers will highlight some important work that's done in partnership already between the WHO European Office for Investment for Health and Development, located in Venice in Italy, and the non-state actor Nobody Left Outside. this is an example of how an NSA and the WHO Euro office can work together, in particular to reach the most vulnerable people in society. So on behalf of the Venice office, we will have Dr. Chris Brown. She's head of office. But first, I would like to introduce Mr. Lee Baker. He's from Nobody Left Outside Secretariat and director. And I find it a very interesting initiative because it is a collective of different organizations bringing together representation of diverse marginalized communities and to aim to have a unified voice to help improve service provision. So I'm very happy to give Mr. Lee Baker the floor first.
Hello. Hello, everybody.
Hello.
Hello, good afternoon. We had a short PowerPoint presentation. I believe this might be starting now. Yes, I'll speak just after this. We have 1 minute. So I hope everyone agrees that's got a powerful short presentation there. The images come from an exhibition called Points of View. It's on the NLO Nobody Left Outside.eu website, and we presented it at Gastein a couple of years ago. The idea being to bring the voices of marginalized people to the forefront in policy making, which is ultimately the aim of NLO. NLO is a collective of organizations representing very marginalized communities, homeless people, undocumented people, sex workers, people who use drugs, LGBTI communities, and also prisoners. I'm very pleased to see that Dr. Andrew Katis is on the line here. He has acted as the Goodwill Ambassador, and the program receives support from MSD. The raison d'etre is to highlight that these intersecting communities are both at very high risk of poor health, and at the same time face common challenges and major barriers in accessing healthcare and support services. COVID-19, of course, exacerbated, underlined, highlighted, and amplified these differences. So the organizations we represent believe that in the future, post-COVID, we need concerted effort to remove those barriers so that health and social and support services reach everyone, and also and we've actually designed a service design checklist that's published in BMJ Open, peer reviewed, to try and offer a tool to help with that, but also to address long-standing structural barriers. And of course, this begs, we believe, engagement with stakeholder groups themselves, and therefore we've been very happy to partner with the Venice office with some work this year. This was seeded by the publication by the Office of the Health Equity Status Report. And when we discussed that in an NLO meeting with Chris Brown, then it was very clear that there was a very strong potential for engagement based on that. We then collaborated in the development of a COVID-19 briefing, which uses the HSER framework to, I think, fairly uniquely break down the challenges and barriers that each of these different groups faces singly and collectively, because they are very intersecting often, to recommend solutions that integrate those from all of the participant organizations, and to highlight how these organizations and their members, because they're all mostly platform organizations at European level, how communities are acting in support of their communities throughout Europe. This was followed up by a webinar where Dr. Klug kindly joined, and we discussed these issues with the participants. There was also a podcast during what we call NLO Week last October, where Tatiana Buzetti from the Venice office joined to speak about lived experience and how we bring lived experiences to bear in policymaking. And also then two of our organizations representing the LGBTI communities and sex worker communities joined in the one of the Building Fairer, Healthier Societies podcasts following the one by Chris last year around World Health Day. Briefly to conclude, in the future, we look forward to further collaboration with the Venice office. Of course, the Monti report now published, we will be considering some kind of response and there, of course, for the members, priorities going forward include, as you might imagine, equitable access to COVID vaccines for everybody, regardless of particularly residency status, and breaking down of particularly these structural barriers. I think in particular housing, Fianza is one of the participant organizations. You can expect a new publication from them soon that's going to talk about housing first policies to help underpin public health. And lastly, mental health as well. Mental health is a strong focus for many of the groups. And so inclusive mental health programs as well, for example, among sex workers is one priority for the International Council in that space. So I'll end there. Thank you for your time. We very much welcome the opportunity to speak today. I'll hand over to Chris, actually.
Thanks, Lee. That's great. I mean, just building on what Lee said, when COVID struck, it became really clear that the same virus was having more devastating impacts on some more than others in our society. So putting existing health and social inequities into the spotlight, but also exacerbating and laying bare the fractures in society. In particular, some of the people that we saw in the video roll at the beginning have been most negatively impacted, but they were also people who were living more precarious and insecure lives before the pandemic. And these groups are often overlooked. So not long into the pandemic, health and social sectors were coming to us, talking to us, to say that there were major blind spots in community responses, particularly between different sectors and services at the local level. So from our point of view, the partnering with No One Left Out was hugely important to the Venice office to be able to develop equity responsive guidelines for local planners and policymakers. And what made that so powerful and effective was that we were able to partner and draw on No One Left Outside's knowledge, their strong networks, and their connections to marginalized people. And that enabled us to develop and produce practical guidance on how to remove the barriers, not just talk about the problems that marginalized people face, and to enable that to be translated into interventions for marginalized people to stay safe and healthy during the pandemic. I think it's fair to say, and Lee may come back at me on this, that the partnership has mutual benefits for both Venice office, Euro, for our member states, and for NLO, and the lives of those we seek to improve. Through the Venice office Building Healthy and Fairer Societies webinar and podcast series, and through the Regionals for Health Network, which the Venice office hosts, we were able to make these guidance, joined in partnership with NLO, accessible to a really wide range of planners and organizations in cities and regions in real time, health, social and economic planners. We were able then to also provide a shared platform for NLO network members to make visible and heard the voices and lives of those who live on the margins of our societies and to make real their lived experience. And maybe if we just go to look ahead, if Caroline will allow me another 30 seconds, the partnerships don't just stop because we've done a product. These are partnerships, the way that we do business. So we're going to continue to work together with No One Left Outside and other non-state actors at the regional level, as well as with member states and the subnational authorities. And an example is that we will be bringing together non-state actors, those affected and sectors are responsible for employment, livelihood, education, and health to convene around the solutions around mental health, young people, and social exclusion. So thanks very much. I'll stop there.
Thanks a lot, Lee and Chris. Thanks to you both for your valuable experience. It's clear that you both benefited from this partnership, and insights from civil society, from community groups, and in particular people with lived experience are super important for policymaking, because it highlights also the psychosocial consequences of COVID, in addition to the biomedic consequences. And I think more regular and systematic engagement between LSAs and CSOs and governments is needed if you want to indeed move towards a more inclusive health governance. And this is also one of the conclusions of a rapid survey that we have done, led by Deepa Rajan for EuroHealth, for the observatory. We also found that we need capacity building also of governments and officials in order to know how to engage with marginalized groups, because it requires a different skill set, different mechanisms that can be used for having such a conversation, and to also provide a safe space for people to provide their input and to contribute. And it is great to hear that the two of you have worked that out already quite sustainably, and I think it would be nice to hear more of that. Right, I think this concludes the first part of our session, and we have just a tiny little bit of time for a discussion. I do only see one comment at the moment from Mr. or Mrs. Bergioi about the usefulness of the talks and the webinars, which is a great means for cooperation by the European Observatory. I suggest we can. Oh, I see one hands up. Yes, please. Yeah, it's difficult to guess your name from Kazakhstan. Yes, go ahead, please.
Yeah, thank you, Madam Moderator. Dear participants of the technical briefing, Kazakhstan fully supports the activities of the WHO geographically dispersed offices in the European region. Kazakhstan cooperation with the WHO has further deepened with the opening of the geographically dispersed office for the European Center for Primary Health Care in the homeland of the Alma-Ata Declaration in 2015. The agreement on the opening of the center in Almaty was signed by the WHO Regional Director Zhuzhana Yakub and the Minister of Health of the Republic of Kazakhstan, Saridat Kairbekova. It was a great example of a good joint teamwork between the WHO and the Ministry of Health. And I'm proud that I was a part of it together with highly respected Regional Director, Dr. Hans Kluge. The center supports countries in the region and their efforts to strengthen primary health care. The range of its services in the field of direct support to the countries is adapted to local conditions and ranges from political dialogue and strength in strategic guidance to technical assistance and capacity building. To further strengthen primary health care in Kazakhstan, we opened Primary Healthcare Coordination Center on the basis of the National Research Center for Health Development, which is named after Saridat Kairbekova, the minister whose work on reforming the national system led, among other things, to the opening the WHO European Center for Primary Health Care. We thank Dr. Hans Kluge and Dr. Milita Yakub for their continued support of Kazakhstan's initiatives and constructive cooperation aimed at implementing modern recommendations and practices at the primary healthcare level. In particular, we express our gratitude to the European Center for launching a new annual online training program aimed at improving the assessments and assessment of the effectiveness of primary healthcare at the country level. A team of primary healthcare specialists from Kazakhstan, as well as other countries of Central Asia and Eastern Europe, already started to participate in training and evaluate the effectiveness of primary health care at the national level under the guidance of WHO experts. So let me once again emphasize and express our support to the WHO's efforts to strengthen cooperation with the member states and non-state partners. Thank you for your attention.
Thanks a lot, Kazakhstan, for your intervention. I suggest that anyone of you in the audience who have further questions or comments, please do use the chat. And we will now move on and we'll have more time for a broader discussion at the end of the session. So I would like to move to part 2 of the session where we will learn more from different centers and how NSAs could be involved looking forward at implementing the EPW. And the next speaker is Dr. Tamas Evetovic. He's head of office of the WHO Barcelona Office for Health Systems Financing. I also believe that there is a video, but I would like to give the floor to Dr. Evetovic.
Thank you very much, Madam Chair, and good afternoon, everyone. As we heard in this excellent presentation by the Venice office and NLO, the first step on the path to universal health coverage is to ensure that everybody is covered. That is, nobody left outside the healthcare system. Universal in UHC means universal. Not 80%, not 90%, but 100% of the population. Universal population coverage is a prerequisite to financial protection, but not a guarantee. Even in countries with 100% population coverage, there are people who face financial hardship or unmet need due to out-of-pocket payments for health. Our work at the WHO Barcelona office focuses on the question whether people can afford to pay for healthcare in Europe. The regional director argued this week that leaving no one behind is not just a slogan. We support countries by producing actionable evidence on financial protection using equity-sensitive monitoring combined with in-depth country-specific analysis of coverage policies in order to answer 3 questions: who, what, and how. Who suffers from financial hardship? What drives financial hardship? And how to make progress. Can I have the video, please?
მე მყავს დიდი ოჯახი, იქ არიან როგორც მცირეწლოვანები, ასევე ხანში შესულები და აქედან გამომდინარე ხშირად მიწევს ექიმთან სიარულიც და წამლების შეძენაც. ხშირად ყოფილა ასეთი რამ, რომ ერთი და იგივე დანიშნულების სხვადასხვა მედიკამენტი გამოუწერია ექიმს. რაც შეეხება ფასებს, ჩემი დაკვირვებით ეს ფასები იზრდება ყოველთვიურად. ვერ ვიტყვით, რომ ეს მხოლოდ იმპორტულ მედიკამენტებს ეხება, იმიტომ რომ ადგილობრივი წარმოების წამლების ფასებიც ასევე სწრაფად იზრდება.
როგორც ყველა ჩემი ასაკის ადამიანს, მას ხშირად სჭირდება წამლები. მას შემდეგ, რაც ჯანდაცვის საერთო პროგრამა შემოვიდა, ნაწილობრივად მიფინანსდება წამლების ფასი. მაგრამ აქვე უნდა თქვა, რომ სამწუხაროდ, რასაც 3 თვის წინ ვიხდიდი ფასს და ვყიდულობდი რაღაც რაოდენობის წამალს, ეხლა იმ ფასაც შემიძლია ალბათ მხოლოდ იმის ნახევარი ვიყიდო. ჩვენი ოჯახის შემოსავლების დაახლოებით მეხუთედი წამლებზე მიდის. რასაკვირველია, ფაქტიურად ეს ყველა ოჯახს ახარებებს და ჩვენ ოჯახსაც წამლების ფასის ზრდა.
ჩემთვის, როგორც ოჯახის ექიმისთვის, უმნიშვნელოვანესია ხელმისაწვდომი და მაღალხარისხიანი სამედიცინო მომსახურების განხორციელება. ჩვენს ქვეყანაში მოსახლეობის დიდი ნაწილი ვერ ახერხებდა სათანადო სამედიცინო მომსახურების მიღებას ფინანსური პრობლემების გამო. თუმცა 2013 წლიდან მიმდინარე რეფორმებმა გააუმჯობესა ჯანდაცვაზე წვდომა და შეამცირა პაციენტის მხრიდან გადახდები. მოსახლეობა აქტიურად ჩაერთო აღნიშნულ პროგრამაში, გაიზარდა ვიზიტების რაოდენობა პირველად ჯანდაცვაში სათანადო სამედიცინო მომსახურების მისაღებად. აღნიშნული პროგრამა ეტაპობრივად ფართოვდება, ის ასევე ითვალისწინებს ქრონიკული დაავადებების სამკურნალო მედიკამენტებით უზრუნველყოფას. მიუხედავად ამისა, სახელმწიფოს გადახდები ჯანდაცვაზე დაბალია და ხარვეზები მოცვაში მაინც რჩება.
Thank you. By now, we have evidence from 33 countries, published 17 country-specific analysis with policy recommendations. The report on Georgia, which we featured in this video, is not the first one that reached the highest level of government, in this case, the Prime Minister of Georgia, who immediately took action. The story of Georgia shows how much progress a country can make in expanding population coverage and improving access to services if there is political commitment. However, it also shows that improving access to services may lead to financial hardship if patient co-payments, especially for medicines, remain high. The next step for Georgia and for most European countries is to address the main driver of financial hardship, the high cost of medicines for patients. The good news is that it is possible to achieve our ambitious target, a Europe free of impoverishing out-of-pocket payments for health. Impoverishment due to out-of-pocket payments is close to zero in the best performing countries, and they are not the richest member states in the region. This indicates that it is not only about the level of public spending, but protective coverage policies as well. WHO Europe is the only region that provides data on people who are further impoverished as a result of out-of-pocket payments. This is a quote from a non-state actor, the Civil Society Engagement Mechanism for UHC 2030. Non-state actors play a critical role in advocating for better policies. Collaboration and partnership will be even more important now as the pandemic-related economic downturn takes its toll, carry the risk of leaving more people behind in poverty and ill health. We are ready to join forces. Thank you.
Thanks a lot, Dr. Evitovic. It is great to hear the work that you are doing and mentioning the universalism that is so important, but even the proportionate universalism, isn't it? It is universal, but with extra attention from those in need, those that are experiencing financial hardship. And I like that you mentioned that you use NSAs and civil society organizations for advocacy. And that is, I think, interesting for many of you, because if other partners advocate for the work that you do, I mean, that in the end, you will together collectively have more impact. So thanks for this lesson. And let's now move on to the next speaker, that is Mr. or Dr. Kamlin Wickramasinghe. He is acting head of office of the WHO European Office for the Prevention and Control of Non-Communicable Diseases in Moscow. Can I give you the floor, please, Dr. Wickramasinghe?
Thank you very much. Thank you, Madam Chair. And greetings from Moscow, from the WHO European Office for Prevention and Control of Non-Communicable Diseases. We are based in Moscow, and we work with the member states on many areas for prevention and control of NCDs. So our office is highly supported by our donor, the government of Russian Federation, and we work with many non-state actors and other experts to deliver our mandate on reducing the non-communicable diseases and achieving sustainable development goals. At the beginning of the pandemic, NCD community was concerned that NCDs will be forgotten with the COVID-19 pandemic. But our office, working with data and looking at analysis with many non-state actors and experts, was able to publish one of the first papers in Lancet, led by our regional director, showing the close links that people living with non-communicable diseases at the highest risk for severe outcomes from COVID-19, such as mortality. And this has helped to keep the NCD agenda during the COVID-19 pandemic, and also to include NCD prevention and services in the essential package during COVID-19, and also to maintain resources. So we were able to do that thanks to many experts and non-state actors who work with us to look at data and publish and advocate. And moving on, in implementing EPW, the heart of our office is working with data. In many countries in the Eastern Europe, didn't have data about the non-communicable disease burden. with surveys such as WHO Stepwise Survey, Childhood Obesity Surveillance Initiative, and many of those we were able to show the burden of NCDs in WHO European region countries. But with the pandemic, our lifestyles change, our commuting, our physical activity, where we eat, alcohol consumption, all of these changes had an impact. Now we are working with IT experts, IT institutions to develop new digital solutions to collect data through mobile phone applications and other ways. One example is we know last year there's a rapid expansion of food delivery apps in our region without any information or which does not apply any policies that we currently have. We have been able to develop artificial intelligence tools to collect data and provide them to government to take actions and new policies. And our regional director established the Advisory Council for Innovation for NCDs. And we have many non-state actors and associations represented there who's advising us how to accelerate our progress in these coming years. And in implementing these things, we have always looked at the risk of engaging with non-state actors, especially tobacco, one of the leading risk factors for NCDs. We have been very careful following our framework for engagement with non-state actors, but also find opportunities where we can to address the risk from novel tobacco products and others. So we invite all our trusted accredited partners to work with us on the areas such as tobacco, where we are struggling to find trusted partners to work with and which is a high risk. For alcohol, we have the Safer European Region initiative. And for that, we are planning to have civil society forums and priorities for safer actions and support member states with safer champions and ambassadors in the region, which is planned for 2022 May. And another area is misinformation and disinformation related to NCDs, saying that alcohol will protect you from infection or one of the superfood will protect you from infection. We have now held 3 meetings with non-state actors and also consultation with 28 member states to develop a toolkit to tackle misinformation and disinformation related to NCDs, which will be launched very soon. Finally, I come to capacity building. We have worked well with non-state actors and others for capacity building, especially in the pandemic. We were not able to work routinely with our workshops. So we developed NCD Office, our own online platform. Our first course was to our own WHO representatives, WRs on NCDs, how to use innovation during this time. And we completed that. We were supported by National University of Singapore and University of Oxford. Our second course is with the International Federation of Medical Students that we are going to launch to really inspire them to work on NCDs, these young doctors and medical students. And also we are working with the European Society for Clinical Nutrition to look at the nutrition care in TB patients, working with the TB program in our regional office. And many other actors such as the European Association for Study of Obesity, European Heart Network, and European Public Health Alliance to link climate change agenda, sustainability, and NCD prevention with big advocacy role. So thank you to everyone all who have helped us and who are joining for our future events. I invite you to follow the conference on NCDs and digital solutions, which will be co-organized by WHO Europe and the government of Russian Federation in December. And stay tuned, and I hope non-state actors will play a leading role in that, supported by the International Association for Medical Informatics. Thank you very much.
Thanks a lot, Dr. Wickremasinge, for the excellent work. Sadly, NCDs have increased the severity of COVID-19, and you do great important work. And we know that acting on the variety of risk factors that determine NCDs requires many partnerships. We have to be active in so many areas. Also, tackling the commercial determinants of health requires a lot of mobilization of difficult players at the same time. So thanks for highlighting these issues also about misinformation and so on. It's really great. In the meantime, I see some nice links in the chat, and maybe also the conference that you mentioned in December. would be nice if you can, if there's already information available, to add it to the chat box. I would now like to move on to our next speaker, Ms. Francesca Racchioppi. She's head of office of the WHO European Centre for Environment and Health. Also very important area. Ms. Racchioppi, the floor is yours.
Hello, good afternoon. Greetings from Bonn, Germany, where our European Centre for Environment and Health is currently located. Can I say with a little bit of pride that we are the oldest of all the GDOs? We have been in business serving the member states for more than 30 years now, working across sectors to support the advances on the environment and health agenda. So Madam Chair, you just mentioned how NCDs have been at the fore and a major area of concern during the COVID crisis. Well, at the same time, we were looking at the determinants of NCDs. And certainly the environmental determinants of NCDs are tremendously important here. So when the COVID epidemic started, for our office, we had to start operating immediately on two fronts. The first one was to support the member states in the response from an environment and health point of view. Here I have to say we are very fortunate because we have a governance platform for ministries of health and environment and transport that we could leverage immediately. So we were able to start a series of webinars, the so-called knowledge in the making webinars, where we have been bringing scientists together with the member states and local authorities to discuss the state of knowledge and the state of action on the different items and issues that were emerging. For example, how can we prevent that the health systems will be overwhelmed in case of heat waves? How can we ensure that people who cannot any longer move around the cities because they are, because of lockdowns, can still meet their needs safely in terms of mobility? How can we support member states to improve surveillance of COVID by working with the scientists to develop new methods for environmental surveillance of COVID in wastewaters? So these have been some of the areas where we have been coming together, developing the guidance. But at the same time, environment and health is also an area that is going to be tremendously affected, but how the member states will go about the reconstruction. There are many funds that are going to be directed to restart the economy. One of our key tasks is to support the member states to make better informed choices. And this is at the core of the EPW. We need to support them to make choices that will not only restart the economy, but will go over and address the systemic failures that to some extent have created the conditions for the COVID catastrophe to be as a tragedy that we have known. So we have a duty, and we are here to support the member states, for example, to implement One Health approaches, looking more into the so far as somewhat neglected dimension of biodiversity, environmental pollution, climate change. And we are doing this now, also looking at how can we support them to take a bold action. For example, next week, again, another moment of pride, we will be launching the global guidelines, the updated global guidelines on air quality. This is tremendously important because we'll provide the member states with the strong evidence-based yardstick to know which kind of targets they should aim to achieve to make a difference for everybody's health. So, and we have been very fortunate to work on this with so many partners. It doesn't stop here, of course, because we are fortunate to be able to use also multilateralism. Instruments like ministerial declarations. We had in Vienna a few months ago, ministries of transport, health and environment coming together to think about more sustainable ways of managing our transport systems, bringing active mobility to the forefront. So this is an area where we are collaborating also closely with the Moscow office and so many partners. And now we want to energize the member states. We want them to be inspired by each other. So together with them, we will be launching in the months to come a campaign that we hope will get a lot of adherence and enthusiasm to showcase how they are building forward better. And this is, and on this one, we really hope to be working together also with many non-state actors. And in a month from now, we will launch the high-level Bonn dialogues on environment and health to start discussing what has been the significance of the pandemic, how it has been reshaping the environment and health agenda, and what we need to take forward to the next political commitments that the member states will take in, hopefully in 2023. We are not doing this by ourselves. We have been working together with a large number of partners, but I wish to highlight in particular, and similarly to the observatory, the role of the academic community. Without them, a work like ours, which is at the forefront of knowledge, we have to work on items that will make it to the policy table in perhaps in 5 years from now. But we have to work now on that. They are our closest ally. We have been working with our collaborating centers, for example, to launch a landmark report on nature and health. We are working with other of these partners to show the links between mental health, green and blue spaces. So there is a lot of innovation that comes here, and we are happy to be part of the European-led consortium, the Health and Environment Research Agenda project, which is bringing together excellencies from all around Europe and beyond to provide evidence-based advice for the future. So we look very much forward to working with them. We look very much forward to working with you. There is a lot that we do across our office in Europe with WHO headquarters, but most importantly, with the member states and for the member states. Thank you very much. And by the way, may I mention also our collaboration with with the Euro Health Net. We have been partners in many projects, and it is also a personal pleasure to see you today chairing this meeting. If you allow me this diversion.
Thanks a lot, Dr. Rakioppi. Thanks for your very nice comments indeed. Indeed, the climate crisis is on our doorstep. In fact, it is already happening. If we look at the devastating flooding in Netherlands and Belgium and Germany and many other crises, the One Health concept is now being launched through the Monti Commission, really very important. I hope it brings many health stakeholders together on this concept, but also the opportunity to work with the sustainability sector and the green sector. There are many initiatives there, and you mentioned already transport, very important. So this is an area of work that I think will even become bigger for our health and well-being. And I was thinking the behavioral insights unit that the WHO Euro has is important also to get the vision and the insight from citizens on changing their lifestyles, for sustainability, their mobility. And it would be good to also see how these methodologies can bring in the views of citizens, in addition to the many non-state actors and partners that you already mentioned, Francesca. All right, now I would like to move on to our final speaker, Dr. Irshad Shaikh. He's acting head of office of the new WHO European Center for Preparedness for Humanitarian and Health Emergencies in Istanbul in Turkey. Dr. Shaikh, the floor is yours.
Irshad, we don't hear you currently. Caroline, I'm not sure if you hear Irshad.
No, I don't hear him.
Now you can hear me.
Okay.
Yes.
Yes.
The technology. So many thanks, Caroline. Honorable delegates, regional director, Euro colleagues, good afternoon, good evening, and very, very warm greetings from sunny, majestic Istanbul. It is indeed a pleasure to present today the budding work and vision of the newest kid on the block, WHO European Center for Emergency Preparedness for Humanitarian and Health Emergencies, established in Istanbul with financial support from government of Turkey. Actually, the center was inaugurated in September last year, so literally our birthday of sorts. So I'm wishing myself and hopefully on your behalf, happy birthday. Center embodies Dr. Han's and Turkey's vision that emergency preparedness must work horizontally, borrowing from every health area, expertise, pillar, niche. We are all aware that IHR core capacities and emergency preparedness by definition demand intersectorality. WHO Euro, WHO Emergencies Program, Dorit, I believe on the other side, is our quintessential partner to implement objectives and targets of GPW 13 and European Program of Work. We may be the newest, but the importance of our area of work, capacity building for emergency preparedness, especially in light of ongoing pandemic and lessons learned therefrom, cannot be overemphasized. With our baby steps, we are focusing on our core impact modalities, which include trainings and courses, applied and translation research, partnerships with non-state actors, and strengthening community of practice, and of course, technical assistance to member states. But while we are trying to get the house in order in the first year, the ongoing pandemic has underscored the need to hit the ground running and apply on the run as the need and demand for capacity building for emergency preparedness has grown exponentially. So we are trying our best, and with support of all partners and non-state actors being critical, we are trying to move ahead as fast and as effectively as we can. In this regard, a key lesson for capacity building that has emerged from pandemic for over just under 2 years is that though good health governance is essential, but alone it is not sufficient for effective, efficient, and timely response to health threats. Political governance is also extremely critical. Face masks, work mandates, vaccination mandates, vaccine necessity, green pass, vaccination passports, lockdowns, relief checks. These are all quintessential government functions which are way beyond the boundaries of traditional health systems that we draw, learn, and teach. So COVID has clearly shown that unless political governance is also smart, working with health governance, many advanced countries in face of pandemic health systems were struggling, and some still struggling because of, let's say, marginal alignment between health and political governance. Many countries, advanced countries with 90+ scores on joint external evaluations, the IHR core capacities, traditional globally agreed instrument, they had scores of 95+, but in COVID, health systems came out short. So all these other measures which are beyond health, again, I will repeat, face mask, vaccine mandates, lockdowns, all these are political choices and decisions by decision makers subnationally, nationally, regionally, and globally. So whole of society is equally important side by side with whole of government while we are trying to be prepared and ready to respond and recover from the current pandemic and be prepared and ready for future health threats. For whole of government, non-state actors by design and default are extremely critical to impart their influence on political governance. So GDO, this European Center in Istanbul, is working with non-state actors to have simulation exercise scenarios where politicians are sitting together side by side with health authorities at local, municipal, provincial, national, region, and even global to document negative and positive externalities of political decisions on health readiness and response. Our partnerships with NSAs are budding and include academia in Turkey, USA, Greece, countries with other regions, Eastern Mediterranean region, other GDOs, private sector, media. We talked about citizenry for disaster risk reduction in Istanbul. We are working with civil society organizations and citizen representatives to look at what they think are the risks on a daily basis that they are afraid of. Istanbul already sits on the earthquake fault line. Then media, intergovernmental entities like ASEAN, Turkey Council, all these partnerships we are working with to strengthen the political governance part of emergency preparedness and response. So the emphasis on day of inauguration from Dr. Hans Kluge, our regional director, and His Excellency Dr. Fahrettin Koca, a Minister of Health Turkey, was think globally, act locally. And we are following to have now member states granularity, regional focus, but with a global lens. So I will end with a sentence: think big, start small, act now. Emergency preparedness for pandemics, future pandemics, and other threats need to start now while we are responding and recovering from the current pandemic. Thank you very much.
Excellent, Dr. Shaikh. These are some very clear messages, very important messages too. And I like how you have stressed the importance of political governance in addition to health governance, and how you are working with NSAs also to build their capacities, and how you also are working with CSOs and have them helping to identify the risks. And as you know, CSOs are at the local level, and we have seen that in COVID, have been able to quickly adapt to the situation and identified needs. They have been able to mobilize resources, human resources, but also sometimes financial resources to support people in the pandemic. And as you say, emergency services need to be looked at horizontally. This is a great work. And this concludes all of your presentations and all of the great work that you are all doing. And it's a bit unfortunate that this an hour and a half session doesn't do justice to all of the work that you have all been doing in the past year. But c'est la vie, we have not that much time, but we do have some time left now for a discussion, and I would like to give people the floor if you want to make a question to the panelists or to provide and make a comment. And at the same time, I still see in the chat many useful resources and links that I would like to invite you to look into. So if I first can see if there is a question from the floor, please raise your hand virtually. I will allow some time. I see there was one question in the chat from my colleague, actually. So Dorota Sinkovic, if you want to take this opportunity to ask your question.
Yes, thank you. Can you hear me?
Yes.
Yes. Thank you, Caroline, for giving me the floor. Yes, I actually posted two questions because I find the conversation and the presentations from the offices super interesting. And I had a question for the Barcelona office. How concretely you do you use the collaboration with the NSAs, with the CSOs in your particular field to leverage the messages that you wish to reach the finance, the economic decision makers, because that's such a difficult field, I think, to still a kind of inject the messages of the public health community. And then I had another question, like basically I'm interested to hear maybe from if possible, of course, if from each of the geographically dispersed offices, like kind of one piece of advice, recommendation for the NSAs who are here, like what could we perhaps do better or improve in order to collaborate better in kind of building the synergies between those different governance levels. Thank you.
Thanks, Dorota. Dr. Ivetovic for Barcelona, would you like to go first?
Well, thank you. Thanks very much for the excellent question. And actually, this reminds me that I'm so grateful for this session at the RC71, because it will give us a huge boost in terms of collaborating more closely with non-state actors. But just a concrete example, when we first launched the regional report, the first regional report on financial protection, access, and coverage policies, we had a session in Gastein, and there we teamed up with the European Patients Forum, a non-state actor, and they were on stage with us, and partly in following up on their external review of the regional report. So that was an example, but that really prompted us to have more active engagement with non-state actors. We had an invitation to go to Brussels. Unfortunately, the pandemic didn't allow that to happen. But more importantly, I think what is really needed is at country level. So there are some countries where we are very lucky with quick responses from ministries of health and government. And there are, let's face it, and let's be honest, countries where it's not as easy as the case, for example, in Georgia was. And that's where we have to walk this very fine line of how we empower non-state actors to communicate those messages that we generate. What we offer is this generation of evidence for each country in the region. And then I think the question is, what would be the most effective form at country level, whether we actually organize jointly events, invite to policy dialogue events, non-state actors, but it's also always in collaboration with the member states. Thank you for your question.
Thanks a lot. Is there anyone from the offices who would like to respond to the second question? So tips for NSAs or how you would wish to work with NSAs that we can take into account. I suppose you just do your virtual hand up so I can give you the floor. Yes, Francesca.
Thank you. In my area of work in environment and health, civil society organization and NGOs, they play a paramount role to push forward the agenda, because they are citizen-based organization. They are organizations that can capture the feeling and the needs of the general public, and they can be heard, and they can be heard very loudly. So if I think of what is going to happen in a month and a half from now in Glasgow, when the governments will come together to discuss what to do about the climate change, and it will be very tough and difficult discussions. It will be so paramount to hear the voice of civil society there, and to keep to keep member states, thinking about the future generations, thinking about the present, and thinking about health. So there is a major effort that is going on. WHO at the global level is working with a larger coalition of NGOs, also representative of the health professions, to raise and to mobilize the society to this effect. So I think that whenever we can speak with the same voice, it is so powerful what can be achieved with the support of civil society, that there is no way we would be able to get as far as we can go together.
Thanks a lot, Francesca. This also resonates, I think, with another question from the Youth Forum, who asked specifically how young people can engage indeed and support with your messages. So if the next two speakers want to include young people in your response, that would be appreciated. So I want to give the floor to Dr. Vikramasinghe from Moscow.
Thank you. Yeah, first question is what non-state actors could do. I think especially for non-communicable diseases, when you are dealing with tobacco, alcohol, food, you know, there are a lot of commercial interest there and a lot of lobbying. So data alone does not advance our agenda. WHO will produce a lot of evidence, data, and recommendations, but we need a lot of advocacy and concentrated plans for those advocacy. I think non-state actors can work closely to look at our future plans, future publications, and align those advocacy. One example is we are launching a WHO European report on obesity on 2022 March 4th. We are already working with several non-state actors to organize advocacy events around our report in Brussels and other places. And with young people, as I said, International Federation of Medical Students and many, we have organized capacity building sessions. So they acquire necessary skills and how to interpret data and play those evidence-based advocacy. Thank you.
Thank you very much. Then Lee Baker, floor is yours.
Hello. Yes, I just to on the how, you know, I guess I just wanted to genuinely encourage the action of reaching out to these groups. You know, we work with many of them at EU level, some at European level, some at national level, some have all of the European level ones, such as Fianza in the homeless sector, PICUM in undocumented people, the International Council for the Rights of Sex Workers and Correlation Network. They all have members in countries across the entire European region. Please do reach out. They're working tirelessly at the moment on various programs which are entirely relevant. And I suppose I just wanted to encourage, don't fear the how, just please do. And if you want to do so via the NLO, you'll see a list of the member organizations and our platform as well. And if we can help, please drop us a line. That's all. Thank you.
Super. Thank you. Yeah, Dr. João Beda.
Yeah, thank you very much. On the really to strengthen this collaboration, like it was said just before, the reach out element is very important. I think that sometimes we're all working in our silos, and it's very important that we think out of the box, and both the non-state actors reach out to WHO, make us accountable, request and demand that we involve you more, and also vice versa. I think that we could really improve this dynamic, and we can be really more effective on that context. I also see that many non-state actors, they have actually national representations and members and so on. And one of our objectives, I mean, the priority for WHO is to support member states. So if you engage also, okay, at your federal level, at your association or organization sitting in Brussels or elsewhere, that's very good, but also true and with the national, I think in many cases that would also support our work and create a lot of synergies. WHO, because of some of the rules that we have to be honest. Sometimes we are shy, super conservative in the way we engage. And I think that there are opportunities, like the RD very well pointed out in his opening speech on Monday. Really, the partnership and fine-tuning, improving these partnerships, I think, is crucial. I think that's one of the areas where we really need to innovate. So innovative partnerships, they can and should be created. Thank you.
Thanks, John. I think the point that you mentioned for member states, you have an important role there too, because they are not at all very good in liaising with non-state actors either. And you can demonstrate and give them the tools how they can do that to achieve a true inclusive health governance. Okay, our last speaker of today, Chris Brown. Please, the floor is yours.
Thanks, Caroline. Just to really pick up on that last point, I think two things, putting together both how to engage young people, particularly in this, and generally work with state actors. What we've found is two things: that we have a massive gap in youth responsive policy. Massive gap, which means that now, for example, youth are most likely to be experiencing livelihood loss, more likely to be experiencing mental health problems, more likely to be in precarious work. And essentially, we need to hear the voices of youth through working with youth organizations, but getting beyond the getting to youth who are left out, youth who are really in these vulnerable or precarious situations. And I think we need to have a dialogue. We already have, through the Monti Commission, the Youth Forum. I think we need to explore that and how that forum can really ensure that we have the voice of different youth, so that we have youth responsive health policies, and that we can then, as colleagues previously are saying, be a resource that, as we've done here in Italy, as we've done in North Macedonia on recovery policies, bring non-state actors round the table with other actors to ensure we have gender equity, youth responses, recovery. Thanks, Caroline.
Thanks, Chris, for highlighting the issue of intergenerational inequalities that we need to look at much better. Okay, then the very last, I give the floor to Dr. Shaikh, very last person, and then I have to wrap up.
Thank you, Caroline. I will not be long. Just to emphasize that in emergency preparedness, community in 99% of the cases are the first responders anyway when major crisis happens, accident, natural disasters, and they are on the ground. So in our case, working with non-state actors is been relatively easy and actually great to connect, because the demand and the need and some capacities already exist, especially in the European region. So what we are trying to build is to look at local priorities, what are the local threats to which locals and community civil society groups can also relate to, and then build capacity, looking at the local practices and past experience, not parachute something from the outside, but giving them the opportunity for us to sometimes learn in many instances also. So emergency preparedness, I think it's a very, what should I say, mutually conducive and strong demand and potential exists. Thank you.
Thanks a lot. And I think we need to unfortunately close. I think this has been an extremely rich session with all of your work, and we had a common thread of the involvement and working with non-state actors. I think we've seen the importance and the roles they have for advocacy, for multiplying your messages, for giving information and insight from vulnerable communities, and many other sort of services and information that they can provide you. But we've also seen that participatory way of working and cooperation doesn't come automatically. That requires energy, it requires capacities, it requires channels for structural cooperation, not ad hoc and fragmented way. And therefore, it would be good to see if the WHO Euro can do something about developing a strategy of how the WHO, and in particular the GDOs and the technical centers, work with NSAs, and how we can make the best out of it all together, and in all of their diversity, because the various NSAs will have all different roles, and we need to map that, and we need to have that much more clear, so that we foster also a culture of dialogue and participation, which is so important to move forward. Okay, I would like to leave it here, and it was an honor to be your chair, so thanks a lot for having me, and I would now like to give the floor to Dr. Butler. Thank you.
Thank you very much, Caroline. Indeed, a very, very rich tour. I appreciate that this has been put together as a session for the member states and for the NSAs. But as Hans and I were just talking just 20 minutes ago, we also learned a lot about the footprint of WHO in the region and needed that reminder because it is quite remarkable the amount of work that is being undertaken by these GDOs, technical centres and hosted partnerships. So a thank you to all of the presenters. All of you noted, every statement noted the power of partnerships and that we needed to do more. I'm really excited about the quarterly NSA open house sessions that the team here in Copenhagen will be hosting. And I would suggest that last recommendation you made there around a strategy could be the topic of our first discussion as we look towards that forum and to engage in a discussion about how we develop the strategy of working with our GDOs, technical centres, hosted partnerships and NSAs to strengthen that partnership in delivering the EPW. So, and I suggest probably go one further and then come back at RC72 and report out as to how impactful that effort has been. Would be a healthy thing for us to do in 12 months' time with the member states. An incredible big thank you to Caroline. You've hosted this beautifully throughout this 90 minutes. Very grateful that you could do so for us, expertly facilitated. A warm thank you to you and to the partnership with EuroHealthNet, of course, which we now go forward off the back of the MOU that was mentioned earlier. I'd also like to thank the Secretariat staff that have been working on this, notably Julie Steffler and Rue Hastings, who are both in the room with me here right now, and the whole team that you don't see that with this camera, but are sat over to the right in the auditorium. A huge thank you to them and to all of the colleagues that have presented and spoken today. With that, we wish you a very pleasant afternoon, evening, wherever you are in the region, and a very, very happy weekend. And thank you for joining us.